Hi everyone, welcome back to IMG Pathway Australia. The NSW campaign is now open, and over the next few weeks, thousands of IMGs from around the world will submit their applications. Unfortunately, many of them won't even be shortlisted for an interview. Now, before you think that's because they don't have enough experience, let me tell you something. I have seen doctors with many years of clinical experience miss out on interviews, and I've also seen doctors with fewer years of experience get shortlisted. The difference is often not how many years you have worked. The difference is understanding what the hospital is actually looking for and presenting your experience in the right way. Today, I'm going to share the mistakes I see IMGs make during the NSW campaign. If you avoid these mistakes, you will give yourself a much better chance of being shortlisted. So let's get started. Mistake number 1, not understanding the role you are applying for. So this is probably the biggest mistake I see every year. Many IMGs look at the job advertisement, see the word doctor and immediately apply. But they don't understand whether the role is JMO, RMO, General SRMO or registrar position. These are not just different job titles. They represent different levels of responsibility, different expectations and sometimes different eligibility requirements. For example, I have seen doctors with years of experience overseas. They apply for registrar jobs simply because they have senior experience overseas. On the other hand, I have also seen experienced IMGs only apply for RMO when they may have been suitable for general SRMO position as well. So hospitals don't ask who's the most experienced, they ask who's the best fit for this role. So if you misunderstand the role, you may spend hours preparing an application that was never a good match in the first place. So before you apply, take the time to understand exactly what level the hospital is recruiting for, whether your experience aligns with that position. Mistake number 2, not reading the job ad properly. So this is another mistake that cost many IMGs interviews. Most people read the job title and then jump straight to the apply button. But the most important information is actually inside the advertisement. Read the essential criteria carefully. Read the desirable criteria, look at the department, then look at the expected responsibilities, then check whether the role is rotational or just based in one specialty. Read the registration requirements, which is very important, and look at the level of supervision. So the job advertisement is telling you exactly what the hospital wants. So think of it like an exam. So if you don't read the question properly, it doesn't matter how much knowledge you have, you can still lose marks. So the same applies here. Your CV, your cover letter, your selection criteria should clearly demonstrate that you meet what hospital is asking for. Now, mistake number 3, believing years of experience are everything. Now, this is probably the biggest myth amongst the IMGs. I often hear people say, I have worked for 10 years, so I should definitely get shortlisted. Unfortunately, recruitment doesn't work like that. Hospitals don't simply count years. They assess whether your experience is relevant to the role. If you're applying for a general medicine, does your application clearly show medical ward experience? And if you're applying for surgery, have you demonstrated relevant surgical exposure? If you're applying for emergency medicine, ICU, anesthesia, pediatrics, psych, or ONG, does your application clearly highlight that experience? So the quality and relevance of your experience are often more important than the number of years you've worked. Now that's why tailoring your application to the role is so important. In the next part, we will talk about the mistakes people make with their CVs, their cover letters, selection criteria, referees, and hospital preferences, because those are the often reason excellent candidates will still don't get shortlisted. So before I finish, I want to leave you with one important message. If you don't get shortlisted this year, please don't immediately assume you're not good enough. Sometimes it's not your clinical experience that's holding you back. It could be that you applied for the wrong role. It could be that you didn't fully understand the job advertisement, and it could be your CV, your cover letter, your selection criteria, or simply the way you've presented your experience. So the good news is that all of these things can be improved. So Take the time to understand the role, read the job advertisement, and submit an application that truly reflects your experience. I hope you found this video helpful, and if you did, please give this video a thumbs up and subscribe to my channel. And we regularly share practical advice, job updates, and guidance to help IMGs then to navigate the Australian medical system. And you can also follow us on LinkedIn, Facebook, Instagram, and join our Telegram community where we post regular hospital job opportunities, campaign updates, and useful resources for IMGs. Thank you so much for watching, and I wish every one of you the very best with your NSW application, and I will see you in the next video.